Now we'll move to the upper extremity exam. And the first thing with any new part of the exam, of course, is to make sure the patient is positioned properly. And for upper extremities, she should be sitting, as we have here. Mary is sitting. And I want to see the whole arm, so I'm going to roll up Mary's sleeves. This is difficult for a patient to do herself, so I'll say, Mary, I'm just going to roll your sleeves up here because I want to see the upper part of the arms as well as the lower part of the arms. So I'll do that on one side and then on the other. And so with inspection, then I'm going to be looking at the arms, looking for symmetry, always with skin, looking at any changes in moles or anything that looks unusual. Look at hands, first back of the hands, then Mary, could you turn your hands over? And then the palms, and looking up the forearms there where I'm seeing the inner aspect of the arms as well. The next step, I'll move on to pulses, and I'll start first with brachial pulses, which you can have the patient make a little bit of a muscle here, the biceps muscle, okay, you can relax, and then you'll find the brachial pulse just on the inner aspect of the brachial tendon, or the biceps tendon here. Again, with any pulse, you have to leave your fingers sit there for several heartbeats in order to feel the pulse. Now I want to compare that to the other side, so I'll make a little bit of a muscle there, okay, good. I'll find the biceps tendon on this side, go just on the inner aspect of that. To find a pulse, you have to press the artery against something. So in this case, I'm pressing it against the biceps tendon. And normal pulses would be 2 out of 4, meaning that the pulse is normal and expected. 4 would be a bounding pulse, but this is what I expect and find here on her brachial pulses. Then I'll compare radial pulses. Now I can check both radial pulses at the same time. Again, I'm pressing the radial artery against the bone underneath in order to feel the pulse here. And I'm comparing sides, and again, 2 out of 4 being normal and expected pulses in this case. Once I've finished with artery exams, checking those arteries, then I'll move on to range of motion. So Mary, I'm going to start with hands and move upwards in terms of how much you're able to move your joints. So if you can make a fist here and spread your fingers out like this, and bring your wrist back and then down. Bring your elbows up and then down there too. Bring your arms all the way out like this and all the way up. Good. Now bring them across the back, and I'm comparing both sides, so I'm going to look and see if she is able to touch her back in equal positions. Now bring your arms down and underneath. And same thing, can she touch her back on equally on both sides, which she can. Okay, you can rest your arms there. So that's range of motion of the arms. Then the next part I'll do is starting with the motor exam. This being part of the neurologic exam, what I want to do is, while I've inspected to start out the exam, I want to specifically look for any involuntary movements. Do I see any fasciculations or little movements of the muscles that Mary herself is not doing? Looking at both sides, I'm comparing bulk. Do the muscles look to be about the same on both sides? And when someone is strongly right-handed or left-handed, that particular arm can be a little larger than the other arm. That is possible, but you don't always see that, so you compare there. I'm checking also for tone. Tone is the muscles, are they relaxed when they're supposed to be relaxed? And how I'll do that is I'll put my hand over biceps tendon, just kind of gradually and slowly move the arm back and forth, move the wrist around, and just having you do this and have the patient relaxed is a good way to do that. And then I'll check on the other side here too. Is there some nice easy motion here on this side that I can move it back and forth? We're looking for increased tone or some jerkiness of the muscle as I'm trying to move it back and forth, or flaccidity or flaccid tone, which would be something that you would expect if a muscle is paralyzed. So once I finish with tone, I'm going to move on to pronator drift. Mary, if you can close your eyes. Well, first let me have you hold your palms out like this and close your eyes. I'm going to be watching Mary's hands for about 20 seconds here. What I'm looking for is there a movement of one hand into a pronator position? I'll demonstrate that. If Mary's hand started to move like this, over like that, that's called pronator drift. And that happens if there has been a stroke in this patient, or if there's some loss of strength on that left side. So this is a little bit of looking at strength and cerebellar function here. And after 20 seconds, I see that Mary's hands are fine, so you can rest your hands back down here again. Now, the next part that I'll check is strength. And strength is something where I'm not particularly checking all muscles, just some of the muscles that demonstrate different dermatomes or nerve roots from the spinal cord. So I'll start first with the shoulders, and I'll have, can you hold your shoulders up like this? And I can check both sides. I want to make sure that the patient has her arms in a position that allows her to use maximal strength. So her arms are up like this, and I'm going to press. Mary, keep your arms there. I'll press down fairly firmly, make sure that the muscles are the same on both sides. All right, you can relax there. Now, the next muscle group that I'm going to check is elbow. So I'll just check on one side first and then the other. And what I can do here is when the elbow is at about 90 degrees, that's a fairly good place for Mary to be able to, for me to check Mary's strength. If I had her arms straight out like this, it's harder for her to expand it or contract the muscles. Or if I had it all the way in like this, that's also a difficult position. So I'm going to put it in a position where it's easy for Mary to flex her muscles. So now pull your arm in towards you, and see I'm bracing myself. Now push your arm out at me. Okay, so I'm checking both elbow flexion and elbow extension there. And then I'll compare to the other side also. So I'll come over here, put the arm at about 90 degrees. Now Mary, push out against my hand, and now pull in against my hand. All right, so I've checked both flexion and extension in those locations. The next part that I'll check is finger abduction or abduction. So Mary spreads her fingers out here on both sides, and then I'm trying to squeeze her fingers together, getting her fingers to abduct or abduct. And I'm putting fairly good pressure on the outside, and she's holding her fingers fairly strongly against that. Now, take this hand and put your thumb and little finger together. This is thumb opposition. So I want to check the strength of this thumb muscle. So I'm going to push against the thumb. Mary, you keep it tightly closed there, and I'm going to try and open up that, or you can sometimes try and pull against it like this, but I really specifically want to check that thumb strength. Now I'll check on this side too, also same thing. So try to keep it together there, and I'm trying to pull it apart also. Okay, that's good. And that's the motor exam of the upper extremities. Now the next part, there is a screening sensory exam where you're just going to be checking and seeing whether the patient feels light touch about the same on both sides. And for this exam, I'm going to ask Mary, can you close your eyes, please? I'm going to touch both of your hands here. Does that feel about the same on both sides?
Yep.
And is there any change in that feeling compared to the way it normally is? Okay, you can open your eyes again. In PDS-4, we'll work more on an advanced neurologic sensory exam, but for purposes of the screening exam, that tells us that there is intact sensation distally in both Mary's hands. Now the next part that we'll move to is coordination. And coordination is a combination of cerebellar function and motor function. So first, Mary, I want you to take your left hand, I want you to tap it back and forth and go as fast as you can. Okay, now you can rest that hand and do the same thing on the other side. Okay, so I can see that Mary can flip each hand back and forth fairly easily, both right and left side. So there's a comparison there of both right and left. Now the next part I'll check is fine motor movements here too. So Mary, with your left hand, can you do this? Touch each one of your fingers, go back and forth, there you go, and go as fast as you can. So I'm watching again, coordination. All right, good. Now, can you do the same thing on the other side? And then you're watching for any differences one side to the other. Okay, good, thank you. Then the last part of coordination is finger to nose test. Mary, can you take the first finger of your right hand and touch your nose, and then touch my finger. And notice what I'm having Mary do is stretch her arm out to almost its full extension and moving around. Okay, you can let your hand rest. And full extension, moving my finger around so that she has to touch in different areas, again, checking different areas of coordination here. Now, can you do the same thing on the other side? So notice I'm having her stretch her arm out almost the full way, and again, seeing pretty good coordination on that side as well. The last part of the upper extremity exam then are the reflexes. And using a reflex hammer, you'll notice that there's two ends to the reflex hammer, both a pointed end and a flat end. Either one of these ends of the reflex hammer you can certainly use. I like to use the pointed end when I want to get the force directed in one particular location. And the flat end is helpful when there may be an area where you're checking a reflex that might be slightly tender, or you're not sure you're exactly on the tendon, so you want to spread out that force a little bit. But I'll show you, first I'll start here with the biceps tendon reflex on the right side. I'm putting my finger right over the biceps. If you're not sure whether you're feeling it or not, you can, Mary, can you flex your muscle there? Mm-hmm. Okay, and let your arm relax. I can find the muscle when she flexes the biceps, or the tendon, excuse me. Then I'm going to take my reflex hammer, and it's important to use very much of a good, strong tapping or woodpecker motion, just like you would check for percussion. Now I'm going to tap right on my finger there, and what I'm feeling is any contraction of the biceps here. I can feel the tendon moving, or I can watch for any movement of the forearm. In either case, you may see some motion there. And Mary doesn't have much in the way of reflexes. Normal reflexes would be 2 out of 4, normal expected reflexes. When there's less reflex or hypoactive reflexes, that's 1 out of 4, or no reflexes would be 0 out of 4. And I don't feel any contraction of Mary's muscle here, so I would say she has 0 out of 4 reflex of the right biceps tendon. And the important thing is to compare now, is that the same as the other biceps tendon? So I'll come around to the other side, and again I'll place my finger right on the biceps tendon, and I'll bring in my reflex hammer, and again tapping right on my finger there, and again I don't see any reflex there, so that would be again 0 out of 4. Now the next reflex I'll check is the brachioradialis reflex. This is position the patient's hand as though the patient's going to be shaking your hand. And then the brachioradialis tendon runs right across this area. I don't know exactly where that is, so I'll usually take the flat end, and you can either tap directly on the patient's arm here, or you can again use your fingers and tap on your fingers. And when I tap on my fingers, I can use a bit more force than what I would do right on this tender area of the forearm here. And then I'll check brachioradialis on the other side, again positioning her hand as though I'm going to shake it. Place my fingers there, and you can see a little bit of a movement of her thumb there. There's a little bit there. So she has trace, or 1 out of 4 reflex on the right side. The last reflex of the upper extremity is the triceps reflex. Between the head of the triceps muscles, go right in that little divot in between. And I'm going to take the point of the reflex hammer, because I need to get down in that area. I'm going to tap again with the same amount of same good strong force in that area, and watch for a reflex. And then I'll compare the triceps on the other side. So to check the triceps reflex on this side, I'll find the little divot here between the triceps tendons. That's where I'm going to aim my reflex hammer. Her arm is fairly well relaxed here, and then I'm going to tap right in that spot here, and what I'm watching for is contraction of the muscle here, or any movement of the arm out in this direction. So I'll tap here, watching here, and watching here for any movement.